Hello, and thank you for choosing to watch this short training video on the Waterlow Score. I'm Scott Harding-Lister. I'm a nurse and also a lawyer and the head of practice here at Apex Health Associates. Apex Health Associates is a specialist medico-legal practice that provides expert witnesses. We have been running since 2012 and we specialise in nursing and midwifery cases. In addition to our extensive panel of nursing and midwifery experts, we now have a growing number of medical experts joining our team. Today, we are going to briefly look at the Waterlow scoring system. This is a tool which is used by clinicians to identify patients that are at high risk of pressure injury. It can be used in primary and secondary care. The Waterlow score is one of many such tools, but in our experience as nursing experts, it is the one which is most frequently used. Pressure sores are a localized injury to the skin and tissue caused by prolonged pressure or friction. Pressure sores are also known as pressure ulcers and bed sores. Pressure injuries should not be underestimated, and they can be a significant injury. They can cause pain, severe infections, immobility, psychological distress and injury, and also hinder the healing process. The Waterlow score is a tool which can be used to identify individuals at risk of these injuries. Developed by the esteemed nurse Judy Waterlow in the 1980s, the Waterlow score has become a transformative tool in healthcare. Judy's vision was to create a simple yet effective tool for her students to identify patients at risk of pressure injuries. The widespread adoption of the Waterlow score attests to its impact on healthcare practices. Built on clinical expertise, the Waterlow score considers holistic factors such as age, sex, BMI, skin type, continence, mobility, nutrition, and special risk factors. These factors collectively contribute to a comprehensive assessment, forming the basis for tailored interventions to prevent pressure injuries. This comprehensive assessment allows healthcare professionals to craft individualized care plans. These plans are crucial in mitigating identified risks and preventing pressure injuries. Tailored interventions, informed by the Waterlow score, significantly contribute to patient outcomes. Assigning numerical values to factors such as age, BMI, and skin type, the Waterlow score determines the total risk for a patient. Lower scores indicate a lower risk, while higher scores suggest a higher risk. Understanding these score ranges is essential for clinicians to interpret and respond effectively. Continuous monitoring is paramount, as patients' conditions can change. Healthcare policies guide the frequency of score calculations, typically on admission and at set intervals thereafter. Regular assessment ensures that interventions align with the evolving risks and need of the patients. In clinical practice, the Waterlow score enables the identification of individuals at high risk of pressure injuries. Clinicians can then produce well-crafted, individualized care plans providing targeted interventions. It establishes a standardized system and score that facilitates seamless communication between healthcare professionals and care facilities. As with any clinical system, the Waterlow score is not without its limitations. Whilst widely used, some criticisms include a perceived lack of underpinning research, subjectivity in scoring components, and an emphasis on physical factors. Continuous improvement and adaptation are essential to address these concerns. In conclusion, the Waterlow Score is a valuable clinical tool which has a rich history. It allows for the identification of at-risk patients and the crafting of individualised care plans. While exceptional, its limitations highlight the importance of not excluding clinical judgment. The ongoing evolution of the Waterlow Score aligns with our commitment to refining pressure injury prevention and providing optimal patient care. Thank you very much for watching this short video by Apex Health Associates.